The iView and I&O resembles the flow sheet but has some key differences. For providers, the flow sheet displays results in a view-only mode. While some of the values charted in the iView and I&O are also found in the flow sheet, this is the only place to find intake and output. Your patient was admitted with urosepsis and is voiding frequently. From the menu, click iView and I&O. The bands that display are dependent on your role in eCare. You want to view intake and output, which is the last band on the list. Because the I&O section only displays totals within a full hour, you must open the cell to see the details of the entry. To open the cell, double-click on the urine output cell for 12 o'clock EDT to view the details. The running totals for I&O display at the top of the screen. When the result detail box opens, click on the link for trend. You will now see the details of the entries for that specific hour. Documents. Documents display in folders on the document screen. There are options for sorting the folders, including by date, encounter, type, etc. Which you use depends on your role in eCare and your workflow. Also, depending on your role, you may be able to create, edit, or sign documents. Documents are filtered by the date range selected. The date range can be changed as necessary so that you can view documents from a wider range of dates. Just like other results, documents cross encounters. Any document that was posted within the selected time frame displays in this section, regardless of the encounter in which it was completed. In the highlighted toolbar, you will see the Add button that opens the screens necessary to add a note. The Modify button allows those with proper roles to modify documents. Printer button allows document to be printed. And the History button opens the screen to show the user the history of the document. The highlighted buttons enable you to change your view of the folders to support your workflow. Type. This default view displays folders divided by type, for example, clinical document or radiology. Status. There are two folders, one for authenticated documents and one for document in process. There is one folder for date. The folder contains all documents posted on that date. Performed by. Folders are labeled with the name of the associate who created the document. By encounter. Documents generated during a specific encounter are in folders labeled for that encounter. And the green arrows move up or down the list of documents, opening each one in the order that they are displayed. View documents. You need to review the results of an echocardiogram performed on your patient on April 22, 2014. From the menu, click Documents, double-click the Clinical Documents folder, double-click the Procedure Notes folder, double-click the Cardiology Procedures folder, double-click the Non-Invasive Cardiology folder, and double-click the echocardiogram folder to locate the results you are looking for. Double-click on the April 22, 2014 echocardiogram to open and to review the report. Orders Profile. There are several different screens and windows used in the order management process. Once signed, orders populate the orders profile. The back arrow is used to collapse the View Navigator. The display has a drop-down list that contains a variety of options for displaying a list of orders. There are multiple ways to filter the orders profile, and which filter you select depends on your workflow. Click Add to access the Add Order pop-up window and start the ordering process. Reconciliation is used by providers to document admission, transfer, and discharge medication reconciliation. Check Interactions, External Rx History, and No Check are buttons and icons used primarily by nursing. In the View pane, orders are logically grouped into Plans for medical providers and nursing, Suggested Plans automatically displayed based on diagnosis, Orders, Medication History, and Reconciliation History. Orders are grouped into categories such as nursing, diet, laboratory, etc. If orders exist in any category in the list, the text is bold. In the Orders section, a check mark in the gray box preceding the bold text indicates that the order and details for the selected section display on the right side of the screen. There are a number of order statuses in eCare. These include ordered, in process, future, incomplete, suspended, and on hold med student, meaning order has been placed by a med student and has not been approved by a supervising provider. Discontinued, canceled, completed, pending complete, as the lab test takes days to result, for example, blood cultures or reference lab tests that are sent out of the hospital to an outside lab, or a test that cannot be resulted daily. Deleted, voided with results, transfer/canceled. View order details. The order profile provides you with many details about a specific order, though sometimes you may need additional information. The order information window can provide you with additional information such as who entered the order, when a specimen was collected, or the order history. You would like to see when an X-ray was completed on your patient. If you want to bring orders into view, click on the category from the View Navigator. You want to view the details of a chest X-ray. From the View Navigator, click Radiology, and from the Orders profile, right-click the X-ray chest order. When the menu opens, click Order Information. The history displays the most recent activity at the top. You can see that the exam was completed at 14:39 by Chris Zimmel. You can also view the results of a completed test from the Order Information screen. Click Results, double-click the X-ray chest cell. When you have read the results, click the Exit button to close the Document Viewer pop-up window. Viewing results is useful when you are awaiting results to be posted but need to verify that the lab was drawn or the X-ray was completed. Click the Exit button to close the Orders Detail pop-up window.